world of aesthetic medicine, facial fillers have been around for quite some time. Yet some people hesitate to try them because they're not quite sure what they can do. Well, now there is a new reason to smile, a new product having a huge impact on people who thought they had to live with those fine lines and signs of aging. We have Dr. Ann-Therese Stubbs of Ann-Therese Aesthetic Medicine here to show us how it works. So welcome again, Dr. Ann.
Good to be here. Thanks for having me.
So this is a brand new product.
Brand new product. It's launching this week. First time you can get it.
Yeah.
It is called Restylane Silk, and it's just a kind of a finesse filler just for the lips and for the lines around the lips that bother a lot of gals as we age.
And you talked about this being, as you said, a finesse product. Talk about what the difference is, because we think of the facial fillers, the plumpers.
Right, and that's what I think a lot of people are fearful of doing their lips because they've seen the Hollywood pictures of people who maybe have gone overboard and they want to look like themselves, but they don't want to look overdone. And this product is exactly for that. It is very subtle and it fills in the fine lines that go around the mouth, and we can kind of talk about what happens to the face as we age. We start to get a little bit of the fine vertical lines around the lips. The upper lip gets a little bit thinner and actually kind of curls in a little bit. And we see a schematic picture here of just kind of what happens to the face as we age. We lose that volume, the corners of the mouth start to turn downward too, and then those little vertical lines, some people call them smoker's lines, but everybody gets them because we all use that little pucker muscle. We use it for water bottles, straws, anything else that causes us to kind of pucker, even the letter W, if you think about it, that saying that word, any word with W in it makes you pucker your lips. And so it works that muscle out, and then we lose the volume on top and you get those little fine lines. And women hate that because lipstick tracks into them.
Sure.
And it just gives us a look of aging.
Okay, so that is something we don't want. First of all, is this only for lips? Is this something you can use in different areas?
It's only FDA approved for lips right now. However, we know that in the next year, people will be doing kind of just some studies to try at different areas, other fine lines, maybe even around the eyes, crow's feet area, just anywhere there's a tiny little line that you don't need a big plumper for. This product is very small particle size, and it kind of seeps right in and gives it a little plump, and it lasts maybe 6 to 9 months, up to a year.
Okay, and Dr. Ann, we're going to see a photo of kind of how it works, and this is giving us a better idea of it kind of just sneaks itself in there.
Right, every place that has a little divot or a little wrinkle, it kind of just fills and plumps out, and it's a very, very thin particle size. So I think this is kind of trying to show you that in that picture there.
Okay, so let's look at before and afters. These are what people love to see. They want to know the possibilities.
Exactly, and they want to know that they're not going to look radically different afterwards. This gal on the left, you can see she's got those vertical lines and a little bit of thinning, so it gave her back a little bit of volume, but certainly not anything that would cause people to stare or that would say you don't look like yourself, and those little vertical lines above her lip are gone. This gal has a little more volume on the lower lip in the after picture, but still a very nice shape to the lip. We also look to make sure that the upper lip to lower lip ratio is 1 to 1.6, and it sounds like a lot of math, but really that's the natural look to a lip. If you overfill the top lip where it's larger than the lower lip, that gives people kind of a strange look or almost a duck look, and that's not what we're looking to achieve at all.
Right, we don't want those when people do the duck lip in the selfies. That's not what we want.
No, that's not what we're going for.
Yeah. So, and this is the kind of thing I feel like people would go somewhere and people would give them the compliment of, you look so much younger.
Right, and it's very subtle, and that's what everybody loves about it. You don't have to, you don't have to have people saying, oh, what did you do? Or, oh, your lips entered the room before you did. We're not going for that. So it basically is a very subtle product, just a little bit of enhancement rather than augmenting the lip.
And how quickly are people seeing the results from this?
It's an immediate thing, and that's what, we do we numb the lip up first with some topical cream, so it's very comfortable. We at our office use a little bit of cold air too. We blow some cold air right on that, so that's a wonderful technique for minimizing any bruising at all, and for comfort. People say they largely don't feel the injection at all. And then you could hand them the mirror right afterwards, and you can see the result.
And is there any side effects people should worry about? Can they go out right away?
Sometimes there can be 24 hours of some mild swelling. We usually have patients ice immediately thereafter just to kind of minimize the swelling. But usually 24 hours, and you really can't tell who's going to swell and who's not. So if you've had a Restylane, a Perlane, a Juvederm product before and have not had much swelling, you're probably not a big sweller. But until somebody's had it the first time, we don't know if that first 24 hours you might not want to plan it, right around a big party. But other than that, that, within about 24 hours, you should be ready to go.
Okay, Dr. Ann, if somebody wants to find out more, you have a great offer for us.
We do, because the product is launching this week and we'll have it in our office today. We're offering $125 off each syringe.
Awesome. Okay, and you have free consultations as well at your office.
We do.
Phone number, website up on screen, so thank you so much.
Thanks for having me.